Welcome to Children's Pedcast. Thank you for downloading the show. This is a conversation about pediatrics with Children's Hospitals and Clinics of Minnesota. My name is Jimmy Bellamy, and this week my guest is Patsy Stinchfield, a nurse practitioner and director of infection prevention at Children's. She's been with Children's since 1989, and I've been fortunate enough to work with her from the beginning of my time here a year and a half ago. Patsy is a wonderful representative of Children's and has an incredible amount of knowledge when it comes to vaccines and immunization and infection prevention. We'll talk about flu shots as well as vaccine schedules and just the importance of getting a vaccine to prevent a disease that is entirely preventable with a vaccine. And she will talk about what she has seen in her time here when it comes to measles and other ailments. It's an episode that is incredibly important for parents and families to hear, and it's also a nice, fun episode. We recorded at Patsy's pub in St. Paul, Emmetts Public House. It's a neat little place, and that's the noise you hear in the background, which I think adds to the vibe and the feel of the episode. You can find us on the web at childrensmn.org. We're on Twitter at childrensmn. The same goes for Instagram. You can find us on Facebook along with the rest of the world. And then we're also on iTunes. That's the biggest place to find a podcast. We're also on Podbean and Stitcher. And you can hear our episodes audio only on YouTube and Vimeo. Thanks for listening and enjoy the episode. We've been trying to get together for so long.
We have. I'm so glad we're here.
Yes, and this is great. I should say we're at Emmetts Public House. That's the noise everybody hears in the background, and I really think it adds to the feel of the conversation. Tell us about Emmetts Public House.
Emmetts Public House. We're here. We'll say first that we're drinking Diet Coke.
I have Cherry Coke.
Cherry Coke. But at any rate, Emmett was my dad, and Emmett's Public House was a vision that my family had, and my older brother, who's a restaurant owner here at Dixie's, Sagia, and now Emmett's, floated this idea 5 months after my dad died and said, what do you think about making the party room into an authentic Irish pub? And of course, being the Irish family that we are, we all started to cry, then we all started to cheer, and then we instantly started to plan. So we planned for a good year, and then we opened Emmett's Public House on St. Patrick's Day, 2015. So it's just been open a few months here, and it's been great times.
And with me having no previous experience to this place, I can't believe that this was a windowless party room.
This was a windowless party room.
We're sitting in the front, and the sunlight is beaming in. The sky is beautiful and blue. It's a beautiful day. I couldn't imagine this place not having any windows.
Exactly. And we did a lot of research wanting to make it authentic, but bring in a lot of St. Paul too. And so my siblings, my brothers had not been to Ireland. I said, you can't open a pub without having gone to Ireland. So they did some research, and I had been to Ireland with my husband, and we took photographs of pubs all around America, and we kind of knew what we wanted, and beautiful front windows that open were really a big part of it. But the interesting thing about Public House is, it sounds, at first I was going to no, we don't want to be Emmett's Public House. It sounds like public health, public housing. So I set off to do a bunch of research to say, here's why we shouldn't call it that. And the more I researched about it, the more I fell in love with what a public house is. It now has become shortened to pub. In America, people think of that as bars. But in Ireland, they're like community centers. They're places for people to gather. But originally, the only people that could go would be men, and there'd be like the Catholic men and then the Protestant men. And over the years, they decided to let women in. They had a separate entrance. They had to stay behind a curtain. And then to distinguish where women and children were welcome, they called it a public house, meaning everyone is welcome here. And so the more I researched it to fight against it, the more I fell in love with it. So that is what Emmetts really is. On opening day, we had children and strollers and old people and young people, and we still have, it's a restaurant. It's a beautiful place to come and tell stories. So that's what we're going to do today.
How does this look compared to your vision of it when you had that year of planning?
Exactly how we were hoping. I mean, we're really, really happy with, when I'd lay awake and stop thinking about Ebola and, measles, I'd think about what this room could be like and how it would be a place to gather people. And my dad was a very big gatherer of people, especially strangers. He loved to talk to strangers and making sure everyone was good and, what's your life story about? And he was just a very good guy. And so we wanted to capture that in this space, and we think we did it.
At the risk of making you tear up early on in the conversation, what would your dad think of this place, and especially him being the namesake of it?
Yeah, he, I think, would be really proud of us. I'm one of 5 kids, and he really came from an accomplished and educated family, but they were very hard workers, and he expected that of us kids too. And he wanted us to, do things well and be proud of what we did, and I think he would be very happy with this. Yeah.
I'm glad you said hard worker, because I've seen on a daily basis the work you put into working at Children's, all you do, how often you're called upon in dealing with all things infectious disease. How were you able to fit the planning and the work? This must have consumed all of your free time.
It was really fun. It was at a very busy time. It was during 2014 that we were doing the planning, and I was by day doing Ebola preparations and getting all the materials we needed in the planning and the training and the meetings and the figuring out the budget and answering the governor's calls. And it was very, very, very busy. And of course, flu season and respiratory season is always busy. It was a very extremely busy year. But then, we all have our outside lives. And so in the evenings and weekends, I would meet with my family members and do research and go to antique stores and try to find cool things to put on the wall. And it was, it's nice. You got to have work-life balance. But this was a very big project, and but we had a great big team, and it was really fun to do.
That's cool. The looking at antiques, searching for them would be hard for me, because I would end up getting stuff for myself, I imagine. Just like anytime I go gift shopping for people,
right,
I usually find 1 or 2 things for myself, in addition to what I have to get somebody else. And I love filling my house with antiques. And the thing I love about the word antique is an antique, I mean, it's really a relative word. What an antique is to you can be something to somebody else.
Right.
But this place is beautiful, and I know that my wife, who used to live in St. Paul for 4 or 5 years, and she, I think it's kind of sad we don't live here now. She will love this place, and
good.
I can't wait to take her.
Bring her soon.
I will. And I would encourage any of our local listeners to do the same.
Thank you.
But tell me about your non-Emmetts life.
Mm-hmm.
We work together, and as a member of the communications team, you are highly valuable to us, or I should say I am a member of the communications team, but you are very busy, and it seems like all year there's something going on in media that mm-hmm. requires somebody with your expertise to be called upon.
Mm-hmm. Yeah, so working at Children's for 28 years now, I've grown up in my career as a pediatric nurse practitioner in infectious disease and immunology, and have just been through lots of different things, from what is HIV? Wait, children get HIV? And that whole, wonderful, amazing story of being able to prevent it in children and babies, to the measles outbreak from 1990, and that's where I cut my teeth on really getting interested in vaccines. Like, how did this happen? How did we have 3 children die in the city of St. Paul in 1990 from measles, a vaccine preventable disease? And then going into influenza and outbreaks and Ebola, and it just rolls. It's just always something rolling. And the principles are very similar, understanding microbes and how they work, and understanding how to prevent them, whether it's vaccines or by washing your hands, or wearing the proper mask, those kinds of things. The principles are all the same. And so I think as my role as a nurse practitioner, I learned so well early on to listen to parents and to have them tell their history and their story, that I can do that in an interview. I've just applied that in when you guys in media come and ask a story about whatever it is that's in the news lately. I listen for that piece of the question that I can use as the pearl and take out and elaborate on. So it feels sort of a natural extension of just being a nurse practitioner.
I want to ask you in a little bit how the communication has evolved in your 28 years, you said?
Yes.
Jeez. And
yeah.
It's funny because I've heard many times how long you've been here, how long you've been in that line of work, and still it seems much shorter to me. It's like every time it seems to be longer, and I hope that doesn't insult you at all.
Well, we're all getting older every day.
Jimmy.
We've known each other a while.
But I mean, I've been here almost a year and a half, and I'm like, really? Yeah, I suppose 28 years.
Yep.
There's so much that has changed in that time. Of course, now the news cycle is 24 hours, and there's so many different ways now to communicate. I mean, who would have thought when you started that we would be recording a show from the hospital that we are putting out, and we're able to just create this content, and no journalist is involved.
Right.
It's wild. Were you always naturally comfortable in front of a camera or with media, or is that something that you just learned on the job?
Oh, I don't think I'm comfortable. I don't think I've learned it yet, but
Okay, maybe I can't tell how you feel inside when you're doing it, but you look like you are just as comfortable as the reporter doing the interview.
Yeah. Well, so here's my secret. I just have to completely pretend that I'm in a clinic room, and the person that is asking me the questions is the mom, and the camera over there is the patient, and it's just the three of us in the room. And if I think what's beyond that camera, I just get very nervous. Mm-hmm. So I try not to think about it. So I just put myself and pretend I'm just doing what I do and talk to people in clinics. So, but yeah, it's if I never had to do another interview, I'd be totally happy with that, because it is stressful, and it's a big responsibility. I'm representing children's. I'm representing facts and science. I'm trying to balance sometimes where there isn't a great answer, like why are we doing all this for Ebola? I mean, okay, well, that's kind of bigger than me. It's not my personal opinion. So it's a big responsibility, and I take it really seriously.
And that is such a large responsibility, as you said. You're not just talking about, and this is with all due respect to any other occupation, you're not just talking about a sports team's performance. You're talking about information that the public needs. And we have a team of experts, an organization full of experts that are the best to provide this information. And I can see where that would help you get over any jitters you may have. Because you are that bridge from the hospital to the public.
Right.
Able to give the information. I mean, I think about all the times we've had to work together, and whether it's you translating the language for me and others in our department, or us working on a way to say, okay, now here's the official term. I mean, we speak in acronyms so often and abbreviations, because some of these scientific medical terms are so robust and verbose that you've done a good job of helping us put it down into, I guess, layperson's terms.
Yeah. And I think it just goes back to, as being a mom myself, and, my children are up and out of the house, but, I was a young mom, and you just want straight answers. You want it to be clear. You want it to be helpful, and that's, what I try to do. But you asked about how communications have changed, and, I mean, it is unreal how much communication has changed since I started at Children's in the late 80s. And, we were really excited when we got a fax machine. I mean, like, oh my gosh, we can get faxed records from our clinic to your clinic and your clinic to my clinic.
And I still don't know how to use one.
Yeah, we thought that was like the greatest thing ever. And then I remember the first day a parent came in with this downloaded from a dot matrix printer, but an internet downloaded a bunch of articles on their child's disease, and like they had read them all, and they wanted to talk to me about all those things that they had read, and I was like, wow, this is a new day. And so from that moment on, the pace really picked up. So, now the internet comes of age, and then social media with Facebook and Twitter and the as you said, the 24-hour news cycle. You just have to keep up. You have to keep up with all of that, and that has been probably the biggest change in my career in communicating with people, is that I have to know what they know. They need to know what I know, and to be able to communicate clearly, you just have to stay on top of it all.
There's no way you would have even thought about a tweet back when you were getting faxes in the late 80s. I'm not even going to tell you where I was in the late 80s.
No, I know. Were you born?
Yeah, of course I was. I was born in 81.
Oh, good. I'll see. I wasn't too far off.
So
yeah.
If you're looking at, 28 years, 87.
Yes.
I remember the Twins won the World Series that
That's
October.
Right.
It was exciting.
It was
so I was 5 and 6 years old. So
yes.
I would have been a first grader.
Yeah. Well, I had been married 7 years and had just moved back to good old St. Paul. So, yeah, it's really wild to think of it that and I'm on Twitter. I mean, I'm old, but I
use
tweet.
it. You use it very well and
do.
effectively. And my hope, and people on this show have heard me say it before, my hope is that more of our staff will utilize Twitter. It's a great tool, and we found in our vaccination chat that we did in August, people so much value that expert opinion. And if you can provide somebody with either a service or information without them having to physically go to see you, they appreciate that so much. It's free and it's accurate, and they eat it up. They love it, and
it's what's on their mind.
Yeah.
And they want to talk about it.
And they need that reassurance as well. I mean, how many of us have gone to Google to look up something, whether it be an ailment or even if it's something for a home repair? You need that assurance or that reassurance that, okay, this is the course, this is the step to take, this is the next move.
Yeah.
And I mean, we have the experts, and we slowly but surely we do have more and more people on it, but I didn't even need to. You were on it, I think, before I even got here.
Let me be clear. I went on reluctantly. I did not. I thought, I don't have time. It's too much input. I don't want people to, come and harass me. And I resisted it, and I had to kind of go to remedial Twitter class because I didn't get the limited characters right away. But then I started using it, and I was like, wow, this is powerful. And the speed with which you can share an important piece of research, it comes out, the article, the link, and you can say, you read it and you say, this is good science, this is good information, colleagues need to have this, the public needs to have this, my patients and their parents need to have this, and you can tweet it out. And and then everyone who receives it can tweet it to theirs, and it's just a spider web of good information. Now, the challenge is the internet has, its wonders and its not so good things about it. And so helping our parents, I think we have a responsibility to help them find reliable resources and reliable sources on the internet and Twitter and Facebook and all these other places, because there's a lot out there, and especially in my world of infectious disease and vaccines, there is a lot of junk, and it can look really pretty and really official and really thorough, and it's not good. And so if a parent reads that and is misled, then the internet has failed them. We have failed them. So we have to help people find, good scientific evidence-based information that they can understand. And we have to provide that too.
And it's a battle, because the internet and its respective social media channels are equivalent to an open field. Anyone can gather there, say and do what he or she wants. And there are times where if you are a consumer of the information, you can, go back in your house and you can shut the window and you can shut the door. But it's sometimes difficult to do that because it's constant. And we do see that as the content creators, you do meet opposing points of view and depending on the respect level that person has, or the level of appropriate behavior, some of it is difficult to deal with when it comes to people who are, we'll use the word passionate about something. And you're right, though, it can be a confusing thing for anybody using the internet or using these social channels. And I've seen it in my short time here at Children's, not realizing that as an outsider, someone outside of the world of healthcare, I didn't realize the severity of the importance, the extreme importance that vaccinations have. I've always been vaccinated. My parents were great with that always, and I think they were great parents in many ways.
Yes.
Still are.
Yes, they did a good job.
Yeah, thank you. And you haven't met my other three brothers, but I think, yeah, if you did, you'd say, okay, yeah, they did good.
Yeah, they did.
Once I got to Children's and did my own work in reading up and studying up on things, realizing just how vital they are, I feel like I'm now that torch carrier that more people should be, because it's not an optional thing, in my opinion, as far as, and I'm not talking about California passing that law now, which is I think a step in the right direction when you're talking about
Definitely
what we need to do to keep everyone safe. But I used to think that, oh yeah, I knock on wood, I seldom feel ill ever. A year plus will pass before I feel anything more than a cold. So I think like, I'm good with my hospital visits. I don't really, other than the annual, I don't need anything else. Not realizing that, no, these are life and death scenarios, and I don't mean to exaggerate it. I don't think I am, and I don't think there's a way to. But talk about when you made this decision to become a nurse, just the way you've lived your life, and how this is really a thing you need to carry with you always.
Yeah, so I think when it comes to vaccines, my voice and our voice from Children's is one of first-hand experience with vaccinating and seeing that just about everybody, all the millions of kids in those 28 years that we vaccinated, does fine. And that it is very, very, very rare to have a serious side effect. So you see the goodness in that parents bring their kids in, they get vaccinated, they do fine. And then we also, being a hospital-based clinic, we have the very unfortunate view of seeing what happens when kids aren't vaccinated and they come in and they get measles, or they get Haemophilus meningitis, or they get pertussis. And we have seen firsthand how awful that is. And having parents, look you in the eye and say, why didn't I vaccinate? And I, I'm kind of asking myself that question too. But of course you listen and you say, we need to talk. We need to talk more, because this disease, and thankfully most of these kids survive. Some of them don't. We've had children die over the years of many of these kinds of vaccine preventable diseases, meningitis and other things. And so our job is to make sure that people get right information, so they're not in that ICU asking us that question, like, how did I get here? Why did I get here? Why did I think that I could skip these? It's like the light goes on and they're just like, oh my gosh, what was I thinking? And that's where I think it's easy for us to get passionate about it as Children's, to say we know both sides. We know that we give a lot of vaccines and kids do really, really well. And we know that those kids who don't get vaccinated get sick, and they get really sick, and they come to us in their darkest hour. And we do what we can to save them. And so that voice, I think, is very unique. There's not too many people who can see inside an ICU and know, the consequences of skipping vaccines.
Tell me about the scheduling of vaccines. That's something that people seem to mention, whether they're first-time parents or long-time parents. Why do we have the schedule we have for vaccines, and why is it important to not deviate from that?
Mm-hmm. So the schedule is evidence-based. There's a few things. One is we have it on a standard approach based also on when kids respond to the vaccines, when their immune system's going to recognize that vaccine, make a good response, and then build upon that. So, for example, the live vaccines, measles, mumps, rubella, varicella, we wait until the baby is 12 months old. If we gave that at 2 months old, the mom's antibodies that to measles and chickenpox, for example, that have crossed the placenta are with that baby still. If you vaccinated at 2 months, it's the antibodies would say, oh, we're already here, we're good, but then those mom's antibodies wane and they go away by 9, 10, 12 months of age. And so we have to wait to give a live vaccine so we don't give it and then the immune system's confused, saying we already have these antibodies, those antibodies go away, and then they're not protected. So knowing when to give it is really based on the vaccine, the immune system, the response. So live vaccines versus inactivated vaccines. There's some vaccines that need to be boosted, so you get it at 2 months and you don't get up to its 100% protection, and so you have to get it at 4 months and at 6 months and at 12 to 15 months. So that boosting interval is science-based, looking at, well, how many doses do we need? How close together should they be? How far apart do they need to be? So the schedule is very important. And then we also roll it into what we want to do with primary care visits. So vaccines are important, but they're not the only thing. We want to talk to parents about their child's nutrition and development and growth and check them up, make sure their heart's okay, their lungs are okay. And so we build that into the primary well-child schedule as well. And when parents cherry pick, that's kind of, I want this, I don't want that, I want this, but I want to spread it out. It really isn't based on science. There's no scientific reason to say, oh, I don't want my baby's immune system to be overloaded. Your immune system is as vast as an ocean, and we're adding 3 spits into that ocean with these 3 vaccines at this visit. So.
And from where does that thinking come? Is it just the idea of a child being, for lack of a better term, stuck with a needle X amount of times that makes a parent think that, whoa, I need to change it up?
I agree with you. I think the needle has a lot to do with it. That if we were just going to, breathe it or swallow it or take it in a more mild manner, I don't think we would have as much pushback and anxiety over it. But needles are not fun. Nobody likes them. It does cause pain. We're trying to do a lot around reducing that pain. But I think that is part of it, is that you just see the number of vaccines and the number of pokes that required to give that. That's where combination vaccines are very important. I'm on the CDC combination vaccine work group, and we're trying to get more vaccines into one poke, so to speak, and so you get lots of protection without that injection pain.
Now, I feel like I say this every episode. As a non-parent, I have to throw that out there, but I wonder if other parents think this too. What's the difference between measles and chickenpox?
So they're both viruses. They're 2 different diseases. They used to be very common in when I was a child in the 50s and 60s. The vaccine for measles came in the early 60s, and the number of deaths per year in the United States just plummeted. The number of cases plummeted. And measles is a virus that is the most contagious virus, human-to-human virus. It's the only, living organism that gets it are humans. And it is the most contagious infection. If somebody walked through this room and had measles, and say none of us in this room were vaccinated, 90% of us would get get measles. Chickenpox is another type of virus, and the vaccine became available for that in the 90s. And you think, well, chickenpox, that sounds kind of cute. It can't be too hard. And again, we at Children see the kids who get chickenpox or varicella in their brain. They get it in their lungs. They get it in their throat. They'll get it a skin infection from scratching, and then it becomes infected with staph. They're in the hospital for days and weeks, and sometimes need skin grafts. So, before the chickenpox vaccine came around, there would be 400,000 cases a year, and you'd have several hundred, 100 or so deaths per year in children and adults. But you'd have a group of people too that would be hospitalized. And so I can't really tell a parent. I don't really know what group your child's going to be in, that if they're going to have mild chickenpox and it's no big deal, itchy, scratchy rash for 5 days, or they're going to be in that group of getting hospitalized, or in that very small group who are going to die. But why do I have to pick? Why do we need to choose? Why do we have to guess or gamble, take a risk? We don't need to do any of those things because we have a vaccine that's safe and effective and prevents chickenpox and its hazards, and is not going to cause harm. So we would encourage people to not have to think through that gambling with that risk.
I know this is a conversation about pediatrics, but I want to ask you about adults being vaccinated. I heard a story on public radio today about many adults being under-vaccinated, and I mean, it doesn't surprise me, considering that we have the baby boomer generation, and so we have a lot of people over the age of 50, 60, and I mean, it doesn't take that to be an adult. I mean, we're talking anybody 18 and older. But chickenpox, and you can correct me if I'm wrong, if you have had chickenpox as a child, you can get shingles later on in life, correct?
That's right.
And there's now a vaccine for shingles.
Right.
But it's not always effective, or am I wrong with that? I did hear the report this morning, but I do not have the greatest memory.
So chickenpox is a virus that you get as a young child usually, and it will hang out and live in a dermatome, or one portion of your nervous system at the end of a nerve, and then over decades your immune system kind of gets less strong, and that virus will reawaken and give you kind of blistery type of rash at that same site or part of your body. Sometimes it can be bad enough that it spreads on your face. You can get it into your eye. There's this post herpetic neuralgia, this like chronic pain that you can get with shingles. So it's not an insignificant disease. So there is a shingles vaccine for older individuals, and it is recommended for older individuals to take that vaccine and prevent the hazards of shingles. Adults don't have like a well child check visit, and so we have a very specific schedule of times where we want to see children, infants, toddlers, school age, adolescents, and then you become an adult, and it's like, well, all right, well, women go in annually, and when do men go in?
Mm-hmm.
And sometimes coming in for that adult checkup, some people forget about it. You really need to kind of be proactive. I think adults tend to be kind of illness oriented,
Yeah.
but vaccination in adults is really, really important, not only for the adult, but for cocooning young infants around them that are too young to be immunized. So we really encourage adults to get that Tdap, the one-time tetanus, diphtheria, acellular pertussis, or the whooping cough booster shot. And that way, when a baby is too young to be immunized, if all the adults around them are immunized, they cocoon that baby.
Community immunity.
Yes, community immunity, you got it. And keeps that baby healthy. So whether it's influenza vaccine or pertussis boosters, or adults keeping up on the immunization schedule is really, really important too.
The influenza vaccine was in the news a great deal this past winter. What lessons can be learned from that experience to help with the upcoming vaccine that will be out in September?
Right. So it was a very difficult year on a few levels. One is what we put into the vaccine and anticipated the strains of influenza that were going to arrive in our community. What was in the vaccine was not what showed up as disease-wise. And so we had what we call a mismatch year. And so when you have a mismatch where what's in the vaccine is not what's circulating, you tend to have people getting sicker with influenza. They're getting more influenza because the vaccinated individuals, it's just not working as well in them. So you don't have the protection. So that was an issue. We also had an issue with the intranasal influenza vaccine. There was a stock or a piece of that live virus vaccine that was turned out to be very heat sensitive. And so in the manufacturing and the shipping and handling and storing, there were some lots that basically on a hot day overheated and inactivated it. So, and of course, not knowing until after that was given, and then looking back and saying, gosh, people aren't making antibodies. They're not getting protected with this nasal. And so the manufacturers figured out what the problem was and have changed it for this coming year. So that's good. And it was just, it was a difficult year for the kinds of infections that we saw. We were very busy at Children's throughout the season.
Because you are the expert and I'm simply the host, I do want you to, I guess, give all of the information that I'm about to give. But the flu vaccine, when you get the shot, it protects against multiple strains of flu.
Well, typically 3 to 4 strains.
Okay.
Yes.
So my answer to people when they would say, well, this year's didn't work, my answer is no. Against the main strain or type, or the main strain, yes. But because it protects against others, it was still important to get because you didn't know which one would come around you.
Yes.
So it wasn't like a 0% protection.
So in influenza vaccine, there's typically 2 A strains and 2 B strains, and those get selected usually in the spring, and then the manufacturers create the vaccine over the summer, distribute them to all of us in clinics and hospitals in August and September. And it's really based on, what do we think the strains are going to be this year. And so if we had this mismatch was in one of those A strains, but you still have another A strain and 2 B strains. B influenza tends to emerge later in the spring. It tends to be really hard in children, and we saw that. We saw a late little blip of influenza of kids coming into the hospital, going to the ICU, being really, really sick, and we had some deaths this year from influenza. And so I agree with you that even though we didn't have a good match on that A, it was not worthless. The real holy grail is to what we're hoping in the vaccine science world is to find that universal protein or piece of influenza that will cross over every year and make that vaccine that it would be in every strain of influenza. But influenza is a very wily virus. It changes itself, it adapts and morphs and circulates in different ways that we sometimes cannot predict.
For people listening, I want you to be able to explain as well. When you say we aren't sitting at Children's creating the vaccine. Where is this taking place, and how is it determined what the vaccine will look like each year?
So it's a very complex process and system, and it's...
Well, we have all day.
Very good, and we're in a lovely place. So the World Health Organization, the Center for Disease Control, the manufacturers, the Advisory Committee on Immunization Practices, there's a lot of people who have input into looking at what we understand about influenza, all, of course, the major influenza researchers and vaccine scientists, really looking at where we've come, what they predict might come, and then there's a number of vaccine manufacturers that go off and make the strains that are decided on by the World Health Organization. One company makes the nasal, and other few companies make the injectable, but we're down to a handful of companies. And so if we have a company who in the flu manufacturing process has a problem, a temperature problem, you grow it in eggs and it's not growing. Come on, eggs, get this virus growing. If you've got some problems in it, you could have a shortage, and we see that as influenza vaccine problems as well. So that's one thing about flu, is it is frustrating to people because we don't have a perfect vaccine, and we don't have a universal vaccine like, you get your Tdap, your pertussis booster one time and you're done with that. And we'd love to have something like that for influenza, but we're not there yet.
I want you to talk to me also about, you had mentioned earlier in the conversation about the things you've seen, the patients you've seen, the vaccine preventable diseases that have been here for years. Mm-hmm. When you see either a child severely hurt from an illness or a child even die, what could you say to parents and the public in general, that if they could see what you've seen, how could you convey to them how massively important it is to vaccinate.
Well, I have seen some terrible situations. I've had, as a staff nurse in an infectious disease ward, as a young new nurse, had to hold a baby in my arms, multiple babies with pertussis or whooping cough, and just have oxygen going by and just praying that they take their next breath, and they're turning blue as the sky. And the parents are crying and the baby's gasping, and it's just the most terrifying, awful thing to be holding this patient and just, hoping that they're going to pull out. I've also had the terrible situation of having to take a baby to the morgue who died of Hib meningitis, and be with the family and wait to let them say goodbye, and then that's the end of that baby's life. I've been with a family who have a baby who lost their hearing from Hib meningitis, and that was before we had vaccines. And so now we have this Hib vaccine, so of course it's not hard to get passionate about this. Like, we can prevent that pain that we saw, that terrible situation that young parents are going through. We can prevent it with a safe and effective vaccine. Why wouldn't we do that? And so it's easy to get passionate about it because of some of the terrible things that we've seen and I've seen in my career, and we see at Children's all the time too, to encourage people to follow the science. And that's why we keep talking about this. That's why Children's has spent a lot of resources and is very committed to making sure that we are a voice for parents doing the right thing for their children, of vaccinating them while preventing getting into this situation. That's why I spend a lot of time trying to talk about the science in an easy to understand way, because if we don't, the void will be filled with myths and misinformation, and that's where I think parents don't really know what to do, how confusing it is. I feel sorry for parents today. They're getting just hammered with so many different opinions, and knowing what to do, the right thing to do for your child is really like, find a good pediatric provider that you trust. Find an institution like Children's that is going to be following the science, and have a conversation. But if I have an electrician come over to my house, I don't tell them how to do, I don't think you should plug it in there. I think you should plug it in over here. Or I don't think you should fix this wire. Or when I take my car in, I don't tell the mechanic how to, fix the computer in my car. I don't know anything about that. And so for parents to come to our clinics and say, we're not doing this, we want to do it this way, and this way, is really to sort of not attend to the fact that this pediatrician or this nurse practitioner you're talking to has spent their career seeing the harms of not vaccinating, and they want to have your child vaccinated because they want your child to be safe.
Mm-hmm. And what about the cases where you hear somebody who is resistant against vaccinations, and they talk about how vaccines either harmed their child or they read about vaccines harming a child? When you're confronted with that, how is that discussed?
Well, the first thing I do is listen. And I talk to a lot of parents in this situation that just want to talk to somebody about this. And sometimes clinicians will refer patients to me and we'll talk. But the first thing I do is listen and try to find out, so where is their concern coming from? Did they have a sibling that had a medical reaction to a vaccine? Did they have, something in their immediate family that they need to tell me about, a medical situation? Is it a religious or a philosophical problem? Is it I just want to do my own thing? Where is it coming from? And then, we'll talk about the science. I'll try to hear what they know and where they're coming from, and then we'll go over, what the assessment is, and then I give them my very clear recommendation on what I think that would be safe for them. If this is a child who has ended up in the emergency room because they had anaphylaxis or difficulty breathing or hives or swelling or whatever after a flu vaccine, I would say, I don't think your child should get another flu vaccine. But that rarely happens. It just is very, very, very rare to have a severe reaction to a vaccine. And in my 28 years in children's, I think I can think of 2 children who got admitted to the hospital after a vaccine because they had a reaction to it. Now we're learning a lot more about genetics and autoimmune disorders and mitochondrial diseases and things like that. And so, I think the future is going to be very interesting as we understand more about our unique selves, will we pattern our vaccines in a way that matches that individual? I think for most people it'll be pretty much the same standard thing, but I think there's a lot to come on the horizon on that.
One other thing I have heard from people who are against vaccines is they always talk about quote unquote big farm. Big farm is making money off of all of this, and
Mm-hmm.
what's the reaction to that?
Well, I have gone to the CDC and been on the advisory committee on immunization practices. I was a voting member from 04 to 08, and I represent the National Association of Pediatric Nurse Practitioners. I go to Atlanta at CDC 3 times a year, and the pharmacy groups are there, their manufacturers are there, they present their data, CDC presents their data. I can tell you, I went there as a nurse practitioner from St. Paul, period. Someone who was interested in vaccines and had done some work in vaccines. I didn't have any connections to any organization or pharma or government or whatever. And I have found the people involved in childhood vaccines especially to be, such high integrity, so interested in safety and protection of our kids in our community. The integrity is there, the carefulness is there, and actually, if you wanted to make money, vaccines are not that field to get into. You should make something that you have to take a pill every single day for the rest of your life. You'll sell a lot more, as opposed to a measles, mumps, rubella vaccine that you're going to get once and then twice and then done. So I think the whole big pharma and that we're all in this together and there's a giant, collusion against whoever, I don't understand it. And it's, from my viewpoint, being an outsider going to, if you will, to the inside of where the vaccine decisions are made, I just don't see it.
In addition to getting vaccinated, what are other things like hand hygiene that kids and people should do to remain overall healthy, whether it's avoiding the flu, avoiding colds, and with that, how important or how tied into it is doing that for, as we said, being a part of that community immunity for the people who can't get vaccinated.
Mm-hmm. So I think, first of all, understanding our immune systems are amazing. They're beautiful, they're complex, and while when babies are born, they're weak in a lot of ways. They can't talk, they can't walk, they can't feed themselves.
They don't get jobs.
They don't. Come on. They are weak and they are vulnerable, but not in relation to their immune system. They are born almost fully equipped, not entirely, but almost fully equipped to be able to handle the world. The world is full of microbes. And if our immune systems were not competent when we were born, and some children very rarely are in that situation where they have severe immunodeficiencies, if we didn't have a normal immune system when we were born, we would be very sick very fast. And so that's one thing, is look at your child. As vulnerable and needy on you as a parent as they are, look at them as strong in terms of the immune system. And what we do with vaccines is we use that innate strength that the immune system has, and we introduce it in small doses to some of the worst germs known to man, and allow that immune system to boost and get that shield of protection around that child and their community. And if we don't do that, that just leaves that individual child vulnerable. So I think that, first of all, just understanding that you're born with a lot of good equipment. Secondly, we do live in a world of germs. Your kids are going to get sick. They're going to get colds. They're going to get influenza. They're going to get the stomach flu. That is part of living in a world of germs. Every time that happens, you're building their immune bank. And so the kids who are in childcare, they get sick a lot, but they're probably going to be the healthiest kids in kindergarten, as opposed to someone who is home and not around a lot of people, and then they go to a classroom of 20 kids or 30 kids who are they're going to be sick, then that child may get sick more. So building that immune bank is a normal part of life. Washing your hands, covering your cough, staying home when you're sick, all those important things that we talk a lot about are really, really true and really important to do. And really not only to protect yourself, but your coworkers. Don't come to work when you're sick, doctor, nurse, Jimmy, and media.
I'll tell you, that is one of the perks to, and I'm saying this as nicely as possible, working in a place where your colleagues are concerned about I'm not working with patients every day. I probably should say. I don't think I need to say that. I think the listeners would assume that. I don't work with patients. I don't see patients every day. And I mean visually see them. I don't ever see them as a doctor, obviously. But to work in this environment, if you're not feeling well, and I say a perk, tongue-in-cheek, that if you're not feeling well, absolutely work from home. And we are able to do that because you're putting a lot of people at risk. And working in a place where there are kids who don't have strong enough immune systems to battle the littlest of things, the tiniest of colds, that it's good. I've worked in places where they are very strict about, no, if you're upright, you can come in. And I'm fortunate now to be in a place where they know what matters, I guess.
Yeah. And you're fortunate in your team that you can work from home. You need a computer. So for doctors and nurses who I need a patient to work with today, that's what I do. It's harder for them. And so I think one of the things to know is, well, when am I infectious? When do I stay home? And so you think of most infections kind of like a bell curve. You've got a few days where you feel kind of weird and, oh no, am I getting sick? That kind of prodrome, we call it, or a sore throat, a little achy. And then you may spike a fever, your whole body hurts, you have the runny nose, the cough, you just really can't stop coughing. It's at that point where you really shouldn't be around people if you can't control your cough. It looks like you want to cough right now.
No, I just burped.
Yeah. Oh.
It was the cherry Coke. I burped without opening my mouth.
You did that very elegantly.
I can't hold back the cough. Sometimes I can suppress a sneeze.
Yeah.
But the burp is.
Yeah, there it is. So when you have that cough and fever, you really need to stay home. And then at the end of that bell curve is like your fever's gone. Your runny nose is not so bad. Your body aches are gone. You feel okay to come to work. It's all right. If you still have that little bit of that cough or that tickle, put a mask on if you work in a clinic or a hospital, and any residual infection that you have, you're not going to spread to other people. I think it should feel more normal to us in healthcare and the general public, like it does in other parts of the world. Like I may be contagious to others. I'm going to think about them. Wear a mask. We're a ways away from that in our culture.
Yeah, and I'm a huge. I feel like I mention this every episode. I'm a huge fan of professional wrestling, and I watch a lot of Japanese wrestling. And a significant portion of the people in the audience wear masks on a regular basis at these shows.
I have not watched it, so I don't know.
Yeah, it's. I'm waiting for a wrestler to actually come to the ring with a SARS-like mask.
Yeah,
lack of a better term.
There you go.
Would your kids say that compared to the average parent or the average mother, you were overboard about hand hygiene and things like that? Or was it second nature when they were growing up that, no, this is what I do. I wash before my meals. I wash after I go to the bathroom.
Well, it would be interesting to ask my two daughters that. But they definitely heard a lot about germs and thought a lot about germs, and were taught to wash their hands. But I think there's a lot of people like me who don't do what I do, who teach their children that, as they should. And so my kids are probably more thoughtful about getting vaccinated, and they're all vaccinated. I'm very grateful for that, and that is my most important job, actually, is to be a mom, and it's my most treasured job. And want them to be safe, and I wouldn't want them to go without. And so I've vaccinated them, and I've taught them how to prevent infections of all types.
Has your job as a nurse made you a better mom, or has your job as a mom made you a better nurse?
Oh, that's a really good question. I think both. And so I think as a nurse and being a nurse practitioner, that I learned so much about the human body. I really think that no one should graduate from high school in America without having an anatomy and physiology course. Like, you have to understand how your body works.
I dropped my anatomy class after one semester.
Yes, most people do.
I wanted to be a chiropractor before that.
Really?
And then I realized I needed to change my dream.
Yeah, but understanding how your body works.
Yes, you're absolutely right.
This is part of the problem. Is like, do you know what your immune system does? You need, like, every high schooler should be able to say how their body works. And so I think, being in sciences and helping teach my children about, human anatomy, physiology, and those kinds of things was important. But also, I remember working as a nurse practitioner and not having children and talking to moms about breastfeeding and things that I've never done, and a lot of pediatricians have never done and never will do. But, so going through that experience as a mother and then being able to, and it's not like, well, here, it happened to me, I don't, you don't talk about it that way, but you have a different viewpoint, a different understanding, a different empathy, I think, and being able to share experiences as a mom coming in, talking to other moms and dads.
Have you learned anything in recent years, and I guess recent again is a relative term, but in the last 5 years that you wish you had known earlier in your career? Whether it be something medically or something even administratively.
Yeah, that's a really good question. I think that I've learned patience
with a CE, not TS.
Yes, right. With a CE, I've learned patience in sometimes big things and big changes take a while, and sometimes just timing is not right, and you'll have some ideas or some thoughts about things, and it's just the timing's not right, and so it's not going to go. And just to be patient with things and be patient with people, and trying to get groups to level the hierarchy and sort of appreciate each other. That I think people work best together when they really know each other, and just hey, how are you, and how's your family, and what's new with when was the last time you were in Duluth, and sort of having that kind of more human level, I think, goes a lot farther than you have to come to a committee meeting and who's going to be the head of the committee and those kinds of things. So just being getting more on, I personally think that some basic qualities like kindness and integrity and honesty, are, as old-fashioned as they might sound, are some of the most important things that we can do in healthcare and in any job in terms of getting things done and doing it well.
I think that's important as well. We meet so many people in our line of work, even as someone who doesn't see patients. Whether it's dealing with media or getting to meet patients and their families and help them tell their stories, it is good to find that common ground, because we are all going through life together, mm-hmm. and I guess having this conversation here at Emmetts is a great example of being able to really see the parts of your life that are all over these walls, to see the photo of your dad as just a little kid on his trike, and it's neat to know, okay, Patsy's more than just somebody who talks about infectious disease, and it's a part of what you do, mm-hmm. And it's a significant part of what you do, right. But it is I think, as I can imagine, I guess I've been a patient a few times in this past year and a half, to kind of, and I say kind of because I am not a doctor, to see to take almost a different point of view now when I am, I hurt my knee back in April playing soccer, and I went to a couple doctor visits to help with that, and it's given me a different kind of perspective, mm-hmm. that I didn't have before, mm-hmm. working in this field. So yeah, it is good to be able to kind of know that everybody's a person, for lack of a better term. Yeah, and everyone has a story, and so when you want to get upset with someone because they didn't do well, it's like, well, maybe they have something terrible going on in their life, so is this really that important to go rip on them because you didn't get it in the last half hour?
not really, like calm down. And sort of trying to understand that all of us, whether you're the patient or you're the nurse or you're the doctor or you're the respiratory therapist or the lab person, everyone comes to work at Children's, and but we all have our life stories. We all have things outside, some of them good and wonderful, like where we're sitting today, and some of them are not so good. Like we all have this bag of rocks over our invisible bag of rocks over our shoulders, and
sometimes a real bag.
Yeah, and sometimes
some of us are weird and we carry actual bags of rocks.
And some of those rocks are giant, and they're like big life, like, oh my gosh, you just got a terrible diagnosis for yourself, and now you've got to come and try to do surgery, and keep your mind in it. And so it's I think just we all need to just understand that everyone has a life story, and it would be the best interest of all of us to try to find out a little bit about that life story and cut people some slack because of where they're coming from, and just work together better.
I'm sure we'll have you on in the future for more episodes. We have so much we could have talked about. I mean, we could be here all day. Is there anything before we let you go that you'd like to add or say that you really think parents should know, whether it's about vaccinations in general or something related to your field of expertise?
Well, thank you, first of all, for the chat. It was really fun.
I appreciate you being a guest.
Yes, indeed. And for you suggesting doing it here at Emmetts is really wild, and it's very fun.
Thank you.
But I would say, I think that when you talk about parents, being parents and trying to make decisions for their children, and you talk about us as clinicians and providers trying to do the best thing for our patients who come to Children's, we have the exact same shared goal. We want your child to be the safest, healthiest, happiest, most well-developed kiddo possible. And Children's uses all the tools that we can in order to do that, and we rely on vast expertise and the literature and science to help us do that. So working together for the same goal is a joy and a privilege.
Thank you so much, and I 100% agree with you. Coming from the world of journalism and newspapers, people become journalists for a number of reasons. I was fortunate to work in a newsroom with some terrific colleagues, but we all were there for different reasons. The thing I noticed not long after joining the crew at Children's, and this is not just my team of 16 plus people who are amazing, but everyone who works there is passionate about helping children. Mm-hmm. And to have almost 5,000 people share that common goal, it's an amazing thing, and I'm grateful to anybody who brings their child or trusts us to take care of their child and make sure they're well or make them well. Mm-hmm. And I see it every day, and I'm fortunate to be able to.
It's an honor.
You're a big part of that.
Oh, thanks. It's great to know you.
Thank you, and hopefully we'll have